Now it's time for TIPisodes with quick tips you should know. Techniques you can implement into your workflow right here on A Tale, oh yeah, A Tale of Two Hygienists.
Hi, this is Stephanie Botts, practicing dental hygienist and ergonomic specialist. Today's TIPisode is sponsored by GingiPak. I am excited to share with you not only some ergonomic tips, but also some of GingiPak's products that have ergonomic value for us. So thank you, GingiPak. I'm an ergonomic specialist and coach for dental clinicians and a practicing dental hygienist. To me, the most important person in the operatory is you, not the patient, you. I want to be sure you have healthy habits now to prevent things like pain, reduced quality of life, disability, surgery, and early retirement. I care about the person you are now and also the person you will be 10, 20, 30 years from now. Believe it or not, the little things we do daily now will dictate how we show up decades in the future. I want to be sure you are using body movements and equipment that enable you to practice safer and more comfortably. I remember before I really started learning about ergonomics, I was uncomfortable all the time. I couldn't find a position for myself or my patients that allowed me to actually do my job and be comfortable at the same time. When we're talking about practicing ergonomically, we need to watch our reaching, leaning, twisting, and make sure our equipment actually supports us instead of contributing to our body issues. Again, the most important person in the operatory is you. You cannot do your job to the highest level, not to mention be the person you want to be with your friends and family if you're in pain or at home because you're injured. One aspect of ergonomics is patient comfort. The more comfortable we can keep them, the better it is for us. A comfortable patient is a compliant patient, and we need that compliance when we're working on them. There are many things you can do to increase your patient's comfort. I've had the opportunity to be in many different practices doing my assessments, and these offices really get creative. I've seen things like patient pillows, blankets, noise-canceling headphones, TVs hooked up to Netflix, hand wax, aromatherapy, massage chairs, a refreshment bar, and that's just to name a few. I personally use a couple things to help keep my patients comfortable, which is nice for them, but ultimately helps me with my ergonomics. One of those things is cushions. 99% of the time, I'm using some kind of cushion to support the cervical spine. I know we all have those patients who won't or can't lean back in the chair. I think many of these objections come from the discomfort of not having their cervical spine supported. If we can start out the appointment by supporting their neck with a cushion, we will have far less objections when we start to tip them back. The cushions I use have a strap that attaches it to the chair, so when the patient is first seated, their neck is already supported. I promise if you start to use these, it's like magic. Your patients will be much more comfortable and compliant for you. The cushions also help with controlling the occlusal planes. One side I use for the maxillary arch, then I flip it around to do the mandibular. When we offer things like blankets, headphones, or cushions to our patients, they feel pampered. They feel like we're going above and beyond to care for them, which makes them more likely to cooperate with us. Picture this, and I know we've all been there. Your patient comes in and is very nervous and sensitive. They're jumping around in the chair and they need breaks often. This puts pressure on us to still complete our treatment in a limited amount of time, but it's taking longer because the patient is so uncomfortable. This is when our ergonomics go out the window. We are stressed, running late, and we start to compromise our position to just get the appointment finished on time. When we're stressed and running late, the first thing to go is our ergonomics. So let's try and get ahead of that issue by applying a topical anesthetic to keep them comfortable, which ultimately helps us. Many patients are concerned that the appointment will be painful, and they appreciate something to lessen the pain and sensitivity. This is an area where we have tools to help them be more comfortable, which makes the appointment go much smoother for both of us. A really effective anesthetic is called Gingicaine from GingiPak. This is a 20% benzocaine gel that is so easy to use. I've used several topical anesthetics over the years, and this one is really nice. Some aspects to it are a microtip needle with a 7 millimeter mark and a rounded edge to reduce the risk of damaging the sulcus during application. The onset is about 15 to 20 seconds and has a working time of about 30 minutes. It tastes like strawberries and it flows smoothly into the sulcus. Another thing I really like about this is how ergonomic the syringe is. It's comfortable in my hand and the syringe is really easy to maneuver around the mouth. There have been some other anesthetics I've used that have been difficult for me to hold in my hand, which makes it difficult when applying in the mouth. Patients really appreciate the effort when applying this anesthetic and again, makes them more compliant for us. Ergonomics truly is about every little thing we're doing in the operatory. Using these simple solutions that are easy to incorporate into our day will make a dramatic difference for both us and our patients. For more information about Gingipak and their products, please visit their website at gingipak.com, and links for their social media platforms are linked in the show notes.
A tale of two hygienists.